So looking at the next pregnancy complication which we'll be looking at, we have actually spoken a lot about this. So most pregnancy complications, we look at their symptom like every time we're talking about their symptom, we say heavy bleeding. So this is the heavy bleeding we are discussing now. This is a postpartum hemorrhage. Okay, so for the postpartum hemorrhage, it's just it's a life-threatening condition, right? So you are bleeding excessively after you deliver the baby. Okay, so it's one of the leading cause of what women dying after childbirth. You lost too much blood after childbirth. Okay, so types is, it could be the primary one, which is just within 24 hours that you gave birth. It could be the secondary one, which the bleeding is coming afterwards, after 24 hours to 12 weeks after you gave birth. Do you understand? 12 weeks, that's 3 months. So within 3 months that you gave birth, if you have severe bleeding, that's a secondary type. So causes, we have the 4 T's. It could be the tone, uterine atony. It could be trauma, maybe injuries during the pregnancy or delivery. It could be tissues left behind. It could be clotting disorders, like you don't have thrombin. You don't have clotting factors sufficient, right? So you're just bleeding and all of that. So risk factors is what will make a woman possibly bleed longer. If the labor was for too long, if she had many babies, all right, placenta issues, operative delivery, they had to go into a surgery. If she has had history of this postpartum hemorrhage, okay, then preeclampsia. Symptoms is heavy bleeding, all right, you are passing clots, you are dizzy, you are fainting, there's heartbeat, okay, your skin is pale, you have low blood pressure. So management: resuscitate. She has lost a lot of blood, so you have to replace the blood she lost. So massaging. If there's a retained tissue, you remove it. If there's trauma, you repair the wounds. Okay, she's having issues with bleeding, you handle the blood parts and all of that. Okay, also transfusion, okay, is part of the resuscitation. So that's it for postpartum hemorrhage.